to work hand in hand, accelerating the process of turning knowledge into cures and ideas into impact. This theme reminds us that the ultimate purpose of research is not just to generate knowledge, but to improve health outcomes, enhance quality of life, and shape the future of healthcare. We now officially begin the academic program of the conference. We will be featuring paper sessions, panel discussions, keynote lectures, research reel competitions, and quiz competitions. These all will highlight the spirit of undergraduate research in translational medicine. For the first academic session of this day, the free paper session 1, I would be welcoming moderator Dr. Madiha Shah, Assistant Professor, Department of Medicine, to take charge of the proceedings.
Bismillahirrahmanirrahim. Thank you very much, Dr. Anusha. Distinguished guests, esteemed faculty members, honorable judges, and my dear students, Assalamu alaikum. It is indeed a pleasure to welcome you all to this free paper session of the Undergraduate Research Conference. Today, we'll be hearing from some of our brightest young researchers who have worked hard to bring forward their innovative projects and findings. Now, with great honor, I would like to invite our honorable chairs, Professor Munawar Alam Ansari. Dr. Ansari is serving as Dean of Basic Medical Sciences at Lumhs. Professor Shamsul Arfin, who's serving as Vice Chancellor, Ibn Sina University, Mirpur Khas, and Professor Salman Shafiq, who is the Dean of Dentistry and Allied Sciences at ISRA University, Hyderabad, to please join us on stage and grace the podium with their presence. Thank you very much, sir. We have total 7 presentations, all undergraduate students who will share their research findings with us. Let me share certain ground rules with you. Each presenter will be given 7 minutes slot for the presentation. Presenters will be prompted at 5 minutes to quickly wrap up their presentation. Questions will be entertained in the end, and I kindly request all the speakers to remain within the time limit and the audience to keep their questions brief and focused. Let's keep this session interactive, respectful, and enriching experience for everyone. Let us now begin. I invite our first presenter, Hamna Sheikh from Lumhs. She'll present her research work on a cross-sectional evaluation of histology teaching in clinical years of MBBS at Liaquat University of Medical and Health Sciences, Jamshoro.
Assalamu alaikum everyone. I am Hamna Sheikh, a 4th year MBBS student at Lumhs, Jamshoro. Today, I would be leading you all to this journey of our research study, which is a cross-sectional evaluation of histology teaching in clinical years of MBBS at Lumhs, Jamshoro, along with my co-author Vijay Prem, under the mentorship of Dr. Fahmida Gul. It's not working. Well, before we proceed further, I would at first like to highlight the key subject in our study, which is histology. With its brief yet completely different domain from other subjects, we acknowledge that histology is an integral part of preclinical years for obvious reasons. We also acknowledge that it has been induced in our curriculum because of some reasons, and it just does not end here. It is also a part of pathology too. So ultimately, it becomes crucial to study histology in first year and second year of MBBS. With this exact significance, we built our rationale around the concerning complexities which are faced by the students regarding a sense of dislike towards this subject, despite being a minor one. Even with proper assessments and examinations, students fail to develop a conceptual hold of the subject which affects their academic morale badly. So our main objective was to evaluate clinical significance of histology among undergraduate medical students and to identify areas of improvement in its teaching methodology. We conducted a cross-sectional evaluation among undergraduates of MBBS at Lumhs, Jamshoro through a structured questionnaire on Google Form with the ethical approval of Ethical Research Committee of Lumhs. About 220 responses were collected, out of which 73.6% were able to utilize knowledge of histology in their clinical years. 58.2% of the audience had developed good interpretation of histopathology, and with even more astonishing figure, 91.89% still feels valuable changes to be brought for better outcomes, like integrating histology and histopathology and using modified teaching visual tools. Now, this is a graph showing perception of students regarding histology of which module was the most difficult to study and histology of which module helped them in relevant study of other subjects. Now, surprisingly, both the bars reached maximum peak for the module of hematology. We also conducted a Likert scale for the most controversial part of our study, which was feedback regarding making practical journals and drawing diagrams. 30.9% was the highest figure, falling between rating of 4 to 6, which is somewhat a non-compelling and a neutral opinion. So we compared our results with two other studies. One from Shifa Tamir Millat University, which showed improved retention of knowledge of histology with drawing images, and the other one from Redbound University in the Netherlands, where drawing group of students won the race of better retained knowledge of histology than the non-drawing groups. Well, practically speaking, the results could vary depending on individuals' preferred way of learning the things. So there is no such evidence which could prove that our students do not prefer making drawings and images because of any obvious reason, but just because of their own lack of personal interest. Let's move towards discussing some relevant studies. 41.8% of the audience had difficulty in observing the slides under light microscope, which is definitely a huge figure. Now, a similar study at University of Alicante reported even more than that number of students with same difficulty of studying the slides under light microscope. Guess what? The primary reason which participants in both the studies stated turned out to be common, which was poor development of knowledge of basic anatomy and histology in preclinical years. In another question, 26.4% of the audience were not able to utilize knowledge of histology in their clinical years at all. Now, strikingly, same results were obtained at a similar study at Volo University, Ethiopia, where more than 1/3 of their audience were not able to pull off knowledge of histology in their clinical years. Now, why do students have to face this failed approach? This is the actual question to address. Apparently, students reported insufficient basic knowledge of histology and anatomy in preclinical years, failure to interpret microscopic images, lack of active communication with demonstrators, inability to recall the topic without a prior revision, and less duration of lab sessions, which are all suggestive of poor development of basic concepts. At the same time, students also suggested conceptual focus on the topic rather than a reading approach, eliminating journal writing, use of visual microscopy, which is an innovative tool with proven positive results, using real-life histopathological images to study under microscope, and using Atlas for comparison of normal and abnormal features. Well, to conclude the journey, we have finally come to the end of our presentation with an insight that poor knowledge of histology is a damaging factor for the learning of other relevant subjects too. So the feedback of the students should be acknowledged, and certain described modifications should be brought in the teaching methodology. For future, more conceptual and visual learning with proper assessment should be adopted by the institute. At last, I would like to highlight the study limitation that might have occurred due to a lack of multi-institutional approach for the study purpose. Well, this brings me officially to the end of my presentation. Thank you so much, everyone. The podium is now open for questions and answers. Thank you so much.
Thank you. For our next presentation, I would like to invite Mahnoor Umrani from ISRA University, Hyderabad, and she is going to present her research on vaping and oral health awareness and clinical practice gaps in dentistry.
Assalamu alaikum. Dear participants and faculty members, I am Mahnoor Umrani and I am very delighted to represent my university and present my research topic, Vaping and Oral Health, Awareness and Clinical Practice Gaps in Dentistry, supervised by Dr. Sayyeda Sana Batul, Dr. Ramesa and Dr. Rabia. The background. What are e-cigarettes? E-cigarettes are battery-operated devices that heat an e-liquid into vapor. They have become very popular in recent times. Why? Because of their modern designs, their vast variety of flavors, and their aggressive marketing. Why are they so trendy and how common are they? Globally, they are at a prevalence of 11%, with 6.2% in Pakistan and similar numbers in Sindh. But vaping leads to certain oral health concerns such as xerostomia, gingivitis, mucosal irritation, and certain cancerous dysplastic changes. This raises a key question: how much do dental professionals and dental students are really aware about the clinical side effects of vaping? So the rationale was e-cigarette use is rising and the knowledge of our dentists is limited. This calls upon a structured training and counseling on vaping oral effects and adverse effects. Objective. Our objective was to assess knowledge and awareness of dental students and dental professionals in ISRA Dental College, Hyderabad by administrating an e-questionnaire. The methodology. We utilized a cross-sectional type of observational design using a structured e-questionnaire. Our population consisted of third year and final year BDS students, house officers, postgraduate residents, and faculty members. Our sampling technique was convenient. We used WHO calculator, which yielded 133 participants, out of which we received 119 feasible responses. Our data collection procedure was distributed via WhatsApp, which was a structured e-questionnaire. Our study tool, a 20-item e-questionnaire consisting of 3 sections. First, for demographics, second, for knowledge and awareness, and third, for practice. The data was analyzed using SPS version 20 using chi-square test, keeping a significance level of P 0.05. Now, on to the key findings of the study. As you can see in this blue bar graph, this represents the percentage of the professional status of the participants, the majority being clinical dental students, followed by specialists, then by general dental practitioners, then by house officers. In the pie chart, you can see the gender distribution, with the majority being female and the minority being male. Lastly, in the green bar graph, this represents the knowledge and awareness of the participants. As you can see here, surprisingly, most of our participants were aware about vaping, but unsurprisingly, only 20% had any formal education on the topic. Also, more than 90% of our participants were aware of the harmful chemicals of vaping, but only 61% were aware of any clinical relevant studies on vaping. The awareness levels were comparable across all groups. Our statistical tests also confirmed this, that with a p-value of 0.844, there is no significant association between awareness and professional status. As mentioned previously, there exists a knowledge gap across all levels. This means there is a lack of knowledge from all levels, from senior practitioners to dental students. Less than 20% received formal training, but 61% were aware of relevant papers. Our findings also align with previous research. As you can see, Al-Hajj et al., a 2022 study involving dentists from 11 countries. It states that students are aware about vaping, but they are not aware about the problems it poses to oral health. Similarly, an Australian study by Jung and Ellis, oral health practitioners were aware of vaping, but they lacked the knowledge and formal training to effectively counsel patients. Our study, the research validates these gaps by demonstrating that even experts are not aware of the consequences of evidence-based oral health. Finally, I would like to say that vaping is not a safe alternative to cigarette smoking. It can lead to problems such as xerostomia, mucosal irritation, and precancerous changes. Awareness alone is not enough. We need to turn this awareness into clinical practice, effective clinical practice. We would like to recommend that based on the findings, that we integrate vaping education, that we enhance clinical training for dental professionals, we raise public awareness through community efforts, and we encourage research and policies. As this was a study conducted in a single institution, the study's results cannot be generalized widely. So we recommend that future studies include multiple institutions with a fairly larger sample size so that we can get a clearer picture. We would like to express our heartfelt gratitude to our participants, our supervisors, and postgraduate residents for their kindness and support. Thank you for your time and attention and listening to me. I'll now be happy to answer any questions. Thank you.
Since Dr. Mahanur is in her limited time frame, we can have a question from judges. Dr. Maroon, can you please stay here and answer a question?
Assalamualaikum Manu, and congratulations for being at this podium at such a young age. Manu, I have a question. As far as the background of the research is concerned, you refer most of the references, but where the concern related to the oral health consequences of vaping, there was no mention of reference. Could you please explain?
As you can see
go to
in
the
our
background slide.
As you can see in our references, we used verified references from journals. They all state that vaping has certain oral effects on our patients. They can lead to xerostomia, as I mentioned before, and they can also lead to serious changes, dysplastic changes.
Thank you.
You're welcome.
That was a very informative presentation indeed. I would now like to invite our next presenter, Dua Nadeem Akhtar from Muhammad Medical and Dental College, Ibn Sina University, and she is going to present her research on anger management among medical undergraduate students and its impact on mental health and academic performance.
Assalamu alaikum. I'm Diwan Eri Makhtar from 3rd year MBBS, Muhammad Medical College, Murc-Lumhs. Today I am going to present anger management among medical undergraduates and its impact on their mental health and academic activities. Behind every white coat, there is a human being who sometimes feels stress, pressure, and yet anger too. Today we are going to explore how it impacts their life and also how it shapes them. Anger is a common behavior seen among the medical students with potent negative consequences on their mental health for their interactions and academic performance. Understanding its triggers and effects can guide preventive interventions. The aims and objectives of our study was to assess the prevalence, triggers, and mode for coping their anger among medical students. The cross-sectional study was conducted at Muhammad Medical College and Dental College also included in the month of July 2025. A total of 200 undergraduate students, 174 from MBBS and 26 were from BDS. Participated data was collected through online Google Performa. The Novaco anger scale was also included. Now the discussions. Friends and family were the major anger triggers. Academic pressure was secondly the 58.7% and the workload was 30.4%. Most episodes were short, less than 1 minute, and some lasted whole day. Consequences were anorexia, hopelessness, sleep issues, and self-isolation. The coping strategies were surprising, like internalization, peer support, physical activity, and low help seeking. Highlights for counseling, stress management, and workload relief were needed. Now to the results. Surprisingly, the triggers of anger, friends were the major reason and the most common too. And the second was 46.4% that was due to their family. Consequences of anger. Hopelessness was observed at 28.2% and the self-isolation was 36.6%, which is for our keys. And self-isolation was 36.6%. The duration of anger, some expressed their anger was less than 1 minute, but the one that was our huge concern was that 21% showed their anger was full day. The coping mechanisms were the physical activities like exercise, talking with friends, walking, talking, and also internalization. The contributing factors were workload and academic pressure, 65.9%. Conclusion, among the medical students, it is primarily triggered by interpersonal conflicts and academic stressors leading to their significant effects. While most of the students expressed short episodes, considerable amount of 21% showed their anger was full day, with very low professional help seeking despite recognizing the value of their counseling. Addressing anger in medical students can prevent progression to anxiety, depression, and burnout. The limitations were the single center study with a limited size sample, reliance to self-supported questionnaires, acknowledgement, special thanks to the participants and the faculty of Muhammad Medical and Dental College. Our reference was from Novaco anger scale and Likert scale. Thank you. No.
Thank you, Dua. Do you have any questions?
Just one question. पहले तो इतनी खुशी होती है इतने यंगस्टर्स को देख के पोडियम के ऊपर कि वो अपनी रिसर्च प्रेजेंट करें. हमारे दिनों में तो ऐसा कुछ नहीं होता था. So we really feel proud and satisfied कि हमारी यंग जनरेशन इज़ बेटर देन अस. सो दुआ बेटा बस एक क्वेश्चन है मेरा कि जो आपने क्वेश्चनर यूज़ किया है उसमें उसकी वैलिडेशन का हमें कहीं कोई एविडेंस नहीं मिला कि ये आपने क्वेश्चनर किसी प्रीवियस रिसर्च से किया था या अगर नया क्वेश्चनर था उसकी वैलिडेशन कैसे कराई आपने?
Sir, the questionnaire was basically in form of a Google form that was online, and the students were able to access this through the online Google forms on their Gmails.
that was the type of methodology or कह लेना आपके आपने एक tool use किया एक electronic form का, but still the question is unanswered कि उस questionnaire की validation कैसे किया आपने?
Sir, the evaluation was basically on a Noeco-Enger scale and a Likert scale from which we evaluate our results.
Thank you, beta. Thank you so much.
Thank you, sir.
Thank you, Dua, for such a wonderful presentation. I'll now invite Alina Zehra from Khairpur Medical College, Khairpur Miras, to present her research work on Bridging the Gap, a mobile health intervention to improve medication adherence in hypertensive patients in rural Sindh.
ये जो स्क्रीन को डील कर रहे हैं, अगर यहाँ प्रेजेंटेशन फ़ौरन आ जाए आने से, ताकि वो फिर वो बाद में चलता रहता, ऑडियंस की तस्वीर आती रहती है, तो वो थोड़ा सा दिक्कत होती है.
Good morning, esteemed faculty, respected seniors, and my fellow students. I am Alina Zehra, 4th year MBBS student at Khairpur Medical College. It's an honor to present my research at this prestigious medical undergraduate research conference 2025. My study is titled Bridging the Gap, a mobile health intervention to improve medication adherence in hypertensive patients in rural Sindh. Today, I will guide you through my research journey by covering background, objectives, methodology, results, conclusions, recommendations. We will then discuss limitations and future directions, and then references. Hypertension is the leading cause of cardiovascular disease in Pakistan, contributing significantly to morbidity and mortality. One of the global targets for non-communicable diseases is to reduce the prevalence of hypertension by 33% between 2010 and 2030. However, medication non-adherence remains one of the most critical barriers to effective hypertension management, especially in rural communities. Here, the challenges such as limited access to healthcare facilities, low literacy, poor follow-up mechanism worsen adherence issue. Fortunately, mobile health interventions, particularly SMS reminders, are low cost, scalable, and feasible even in resource-constrained settings. Our primary objectives were to design and evaluate the effectiveness of a simple SMS-based mobile health intervention on medication adherence among hypertensive patients in rural setting in Khairpur district. To contribute evidence for integrating digital health tools into Pakistan's primary care system for chronic disease management. Another one is to compare adherence trend between intervention and control group over the 6-month trial period. We employed randomized control trial. Our sampling technique was non-probability convenience sampling with a study duration of 6 months. We conducted a study at Basic Health Unit, Khairpur Miras. We recruited 150 hypertensive patients and divided equally into an intervention group having 75 patients and a control group having 75 patients. The intervention group received daily SMS reminder and weekly educational messages, while the control group received standard care. Our inclusion criteria were patients who provide informed consent with no gender discrimination in participant selection. Our exclusion criteria were disabled patients and patients who were not able to give consent. The data collection involved obtaining approval from the head of BHU, and consent was taken from the patients in local language. Medication adherence was assessed by Morisky Medication Adherence Scale, MMAS8 scale, that is basically an 8-item questionnaire. Our outcome measures were MMAS8 score and blood pressure readings. The data was analyzed using SPSS software. Moving on to our results, the MMAS8 score showed a significant difference between the groups. The intervention group achieved a mean score of 7.2, indicating better adherence compared to the controls group's mean score of 5.1. The difference was statistically significant with a p-value of less than 0.01. This bar chart illustrates the blood pressure reduction outcomes with the intervention group results displayed in blue color and the control group results displayed in orange color. The blue bars corresponding to intervention group demonstrated more favorable outcomes. The mean systolic blood pressure reduction was minus 15 millimeter of mercury in the intervention group as compared to the control group's result, that is minus 7. The mean diastolic blood pressure reduction was minus 9 millimeter of mercury versus minus 4 millimeter of mercury in the control group. The difference was statistically significant with a p-value of less than 0.05. In conclusion, our study demonstrates that a simple SMS-based mobile health intervention significantly improves medication adherence and blood pressure control among hypertensive patients in low-resource rural setting. This study demonstrates a successful bedside application of a bench technology supporting the integration of digital health solution into primary care to manage chronic diseases effectively. Based on our study, we recommend SMS-based intervention should be scaled up across rural areas of Pakistan to enhance medication adherence. Integration of mobile health strategies into existing community health programs is essential to ensure sustainability and wider impact. Healthcare workers should be trained in the use of mobile health tools. Policy support is needed to formally include mobile health intervention in national hypertension control strategies. We acknowledge that our study was limited to a single district, Khairpur, which may limit the generalizability of the findings to other regions. The 6-month follow-up period was relatively short, making it difficult to assess the long-term sustainability of the intervention. Future research should include larger multi-center trial to validate the effectiveness of SMS-based intervention in diverse populations. Cost-effectiveness analysis are needed to evaluate the economic feasibility of scaling up such interventions nationwide. Here are the key references that support my study. Thank you for your attention. We sincerely thank our research supervisor, Dr. Farooq Banbro, for guiding us. Now I open up to any questions.
Assalamualaikum, Alina. I'm falling in love with the idea because it was really innovative and to me it was really cost effective as well.
Thank you.
I just have a couple of questions. Methodology में ना हमें ये clarity नहीं आई कि who was supposed to text them and was there any mechanism of feedback or the response from the patient? One question. Second question में ये था कि discussion was missing.
Can you please repeat your first question?
My first question was, in methodology, we did not find that who was responsible for sending text message, and was there any mechanism of receiving feedback or the response from the patient that message received and acknowledged? पहला सवाल. दूसरा सवाल ये था कि although idea was very innovative and intriguing, but still the discussion was missing. Did you find any reference from research elsewhere in the world from the same methodology?
Yeah. Talking about the first question, basically हमने जो SMS based intervention start की, तो हमने अपने साथ जो मेरे co-authors हैं especially, तो उस पे हमने
engineers, like we included some engineers, and they know the software about, and हमने एक system होता है जिसके थ्रू आप लाइक सारे कॉन्टैक्ट्स आपको आ जाते हैं कि रूरल एरियाज़ में आपके पास ये नंबर्स हैं, और वो एक जस्ट बाय सिंगल क्लिक आपके पास वो मैसेज चला जाता है,
ऑटो जनरेटेड,
ठीक है. एंड on another question, talking about another question.
Yes, my question is that are our rural areas are so much advanced that they can be treated with the mobile systems and all that androids?
Sorry?
क्या हमारे रूरल एरियाज अब इतने एडवांस हो गए हैं कि हम उनको मोबाइल पर ट्रीट करें?
सर बेसिकली हमने मोबाइल हेल्थ इंटरवेंशन स्टार्ट इसलिए की क्योंकि मोबाइल इज़ अ बेसिक थिंग, चाहे वो नोकिया का हो या एंड्रॉयड हो या आईफोन हो. तो नोकिया आई थिंक रूरल सेटिंग में तो हर किसी के पास ही होता है. इट इज़ मैंडेटरी एंड बेसिक थिंग. एंड टॉकिंग अबाउट सेकेंड क्वेश्चन, या एक्चुअली जब मैंने ईमेल की तो मेरी डिस्कशन की स्लाइड मिस हो गई थी, दैट्स वाई इट्स नॉट इंक्लूडेड इन इट. और ये जो हमने बेसिकली स्केल यूज़ किया है ना, मॉरिस्की मेडिकेशन अडेरेंस स्केल 8, बेसिकली इट इज़ एन 8 आइटम क्वेश्चन एयर, और ये मैंने रेफरेंस लिया था हमारे पास एक कोरियन रिसर्च हुई हुई है ऑन सेम थिंग कोरिया में, और वो मैंने रेफरेंस में इंक्लूड किया है अपने, तो वहाँ से बेसिकली आई पिक दैट आइडिया.
एक रिकमेंडेशन आपको दूंगा बिकॉज आइडिया इज़ सो इंटरेस्टिंग. आप इंजीनियरिंग डिपार्टमेंट के साथ कोलैबोरेट करके ना किसी ऐप के ऊपर काम करें जो सेम उसके अंदर मोडालिटीज़ और भी ज़्यादा इन्हेंस की जा सकती हैं. सो यू मे हैव इवन मोर सब्सटेंशियल रिजल्ट आफ्टर इंटरवेंशन. थैंक यू सो मच.
इंशाल्लाह. थैंक यू फॉर योर एनकरेजमेंट.
Thank you very much, Alina Zahra, for such an innovative idea. My next presenter is Sumaya Maqsood from LUMHs, and she is going to present her research on breaking out in PCOS, a clinical insight into facial acne.
Bismillahirrahmanirrahim. Assalamu alaikum and good morning everyone. I am Sumaya Maqsood from LUMHs Jamshoro, and I am pleased to present to you all about the topic breaking out in PCOS, a clinical insight into facial acne. I will start my presentation with the background of the study. A polycystic ovarian syndrome is one of the most common endocrine disorder affecting commonly the women of reproductive age. It is characterized by the menstrual irregularity and hyperandrogenism. The rationale behind this study was that acne is one of the most common concern among these PCOS patients. However, the limited data was available on its frequency and severity. Moving on to the objective. The aim of this study was to determine the frequency and clinical characteristics of the facial acne in the patient diagnosed with PCOS. To achieve this, a cross-sectional study was conducted at LUMHs Jamshoro from March to April 2025. Around 50 female patients were participated in this study aged 18 to 35 years old. The patients that were participated included the female patient diagnosed with PCOS according to the Rotterdam criteria and were also diagnosed with the facial acne. Multiple data was collected from these female participants including the duration and severity of acne, menstrual irregularity, hyperandrogenism, and also the BMI was calculated from these participants. To assess the acne, the standardized grading scale was used. This research led us to the multiple observations starting with the facial acne severity. Around 76% of the population were reported with moderate to severe acne and remaining 24% were reported with the mild acne. From overall population, 10% of the female participants reported with the nodulistic lesions strongly associated with the higher BMI. Other than the severity of the acne, Other clinical features were also observed in the PCOS patient, including the irregular menstrual cycle, hyperandrogenism, obesity, and psychological stress. As mentioned in this bar chart, the higher number of the population were reported with irregular menstrual cycle, and second most clinical feature were observed of hyperandrogenism. The hyperandrogenism include the sign of hirsutism, seborrhea, or androgenic alopecia. Lastly, the obesity and psychological distress was seen in 60% of the population. Majority of these obese patients were reported with a moderate to severe acne. Moving on to the discussion. This finding highlights three main important points. Firstly, the obesity or the patient with a higher BMI showed the higher acne severity, likely due to increased androgenic production and increased androgenic activity and sebum production, suggesting that the lifestyle modification and weight management can improve these patients' outcome. Secondly, the menstrual irregularity and signs of hyperandrogenism confirms that the PCOS patient have the systematic hormonal imbalance. Lastly, the psychological distress has a significant impact on the patient's life among these PCOS patients and making their symptoms more worse. These all three findings were also seen in other articles as mentioned in the slide. However, one of the article reported that an Iranian woman diagnosed with the PCOS shows no any significant relationship with the psychological stress, suggesting that the impact may differ across the age group. In conclusion, I would like to highlight that our study mentioned the facial acne is one of the most significant and common dermatological manifestation among the PCOS patient, often associated with obesity and hyperandrogenism. According to this research study, our recommendation is that an early diagnosis and integrated management addressing endocrinologists, dermatologists, and psychologists are essential to improve the patient's outcome. I will end my presentation by addressing the limitation and future directions of this research. Limitations included that the study was on small sample size and it was a single center study. Lastly, the psychological stress was self-reported by the patient, experiencing the symptoms like anxiety, self-esteem, and social withdrawal. For future direction, I will say that the large sample size and the multi-center study should be calculated in order to journalize these results, and a proper assessment tool should be used to capture the psychological impact in these patients. Thank you everyone for your attention. I will be delighted to take it.
Very good presentation, and I think we will take the question answer session at the end of this session. So अगर किसी को कोई questions हैं तो kindly they should note down. So we will take the question answer session at the end. Thank you very much, Bete. Thank you very much.
Thank you very much, Dr. Sumaya, for this commendable effort. So now it's the time for our last presentation of this session. For that, I would like to invite Muhammad Amar Ilyas from Indus Medical College, Tando Mohammad Khan, and he's going to present his research work on frequency and determinants of headache and migraine among students at Indus Medical College, Sindh.
Assalamualaikum everyone. I am Amar Ilyas Muhammad from final year MBBS Indus Medical College, Tando Mohammad Khan. So our today's research title is Frequency and Determination of Headache and Migraine among students at Indus Medical College, Tando Mohammad Khan, which is a rural area. Background. Headache and migraines are common among the medical students, affecting academic performance and quality of life. Because there are many many pressure work on medical students and other things. So limited data exists from rural medical institutions in Pakistan. This is another reason that हम लोगों ने collect किया. High prevalence of headache and migraine may impair academic performances, potentially compromising their future capacity to effectively serve humanity in their professional life. So our main objectives to conduct this research are the prevalence of headache and migraine among medical students, because there are many factors that can affect the medical students. Second thing, to assess the association of socio-demic, lifestyle and environmental factors with headache and migraine. Methodology. We use the cross-sectional and questionnaire-based study. Our questionnaire consists of 6 portions, include demographic portions, environmental factors and other things also. We collected 110 samples from MBBS students, age ranging from 18 to 25. Tools. We use ICHT 3 criteria, headache characteristics, international criteria for headache and migraine IDTM screening. Data collection. We collect the data from students by the mean of Google Forms, which is very easy, convenient and time-saving procedure. Period. We use only 1 month from July 25 to July 25. Results. Among 110 participants, which have mean age 21.84 years with standard deviation of 1.70, headache prevalence was 80%. That is a really shocking results. Male students were more prevalent than females, 55.7% males and 44.3% females. It is contradictory against the global data. We have graphs, gender of participants mean 59% males, 41% females. The number of males are high, that is also a limitation to that research. Residents of participants. Mostly participants are from rural area, 57%. 43% are from among urban areas. Headache prevalence 80%, which is very high ratio. Results. Among 88 students who were suffering from headache during past 12 months, headache occurred occasionally, seldomly in 61.4%, weekly in 25%, and monthly in 6.8%, and daily also in 6.8%. Common associated symptoms include light sensitivity and sound sensitivity. That is the 2 major criteria that is described by ID screening tools. So we have graphs, duration of headache, nature of pain and location of headache. In IDIM criteria, there are 3 criteria, 3 symptoms: nausea, disability to perform your finally work, routine work, and light sensitivity. But we add sound sensitivity also, which is a major contributing factor in rural areas, as our medical college, our study base is in rural medical colleges. The overall prevalence of migraine was 31.8%. It is a ratio out of 80% that occurs from headache. Among them, 54.3% were males and 45.7% are from females. That is against the globally data. It is due to some limitations that females took part less in that study. Note, only those participants were screened for migraine positivity that were suffering from the headache during past 12 months, which make migraine prevalence 39.7%. And other we screened for migraine that fulfill the ID migraine symptoms greater than 2, greater than or equal to 2. Means that the students who fulfill the criteria or develop the symptoms of nausea, disability to work, or photosensitivity, or light sensitivity, or sound sensitivity. Only 15.7% migraine positive participant had a prior physician diagnosis. That is also shocking for all the medical students, as medical students contain many informative, they have great information. Discussion. The study findings align with previous studies show higher prevalence of headache and migraine among medical students. However, male representation in migraine positive group differs from the global data. It is due to limitation of participants. Female participants are less while male participants are more. Stress, poor sleep and irregular meals emerge as a major contributing factor. Environmental exposure show no significant link, unlike some international studies. let's go towards the conclusions. Headache and migraines are prevalent at this rural medical college, which is a considerable proportion undiagnosed. Many students are undiagnosed, unaware from the migraine that they develop. Stress and lifestyle habits play a stronger role than environment. Migraines significantly affect young medical students' well-being and academic life. Medical students or any other person, they cannot enjoy their life with the migraine, or they cannot do their routine work. Recommendations and limitations. Recommendations: stress management programs. The medical universities should conduct the stress management programs, routine screening for migraine in student health services, because about 12.6% students are diagnosed with migraine. Awareness campaigns on lifestyle factors. This is very important step in this course. Limitation: convenient sampling. We have the following limitations. We cannot represent all the students. It is due to some limitations, some participations. Relatively small sample size. Gender imbalance, because males are more participant than females. Single center study. Future directions. We have the future directions that we have to aim the spread this study to multi-institutional studies and longitudinal design to explore unit. Thank you very much.
Thank you, Amar, for a wonderful presentation. We have a last presenter. He's Abdul Quddus Mehman from Bilawal Medical College, and he will present his work on assessment of patient satisfaction with the treatment of hepatitis C infection at District Headquarter Hospital, Kotri.
First of all, Assalamu alaikum to all respected chairman and fellow colleagues and faculty members. My name is Abdul Quddus, and I am presenting, and our research title is Assessment of the Patient Satisfaction with the Treatment of Hep C Infection at DHQ Hospital, Kotri, Pakistan. I would like to thank my fellow colleagues, Dr. Usama Narejo and Mohammad Shoaib Ibrahim, for their collaboration during the whole study. Hep C is a major public health challenge in Pakistan, and our country has the highest burden of the chronic Hep C cases with increased morbidity and mortality. The introduction of direct-acting antivirals has improved treatment outcomes and also management by offering high cure rates with decreased side effects in contrast to interferon-based regimes. Patient satisfaction is also important because it is a key indicator of quality of the care and treatment success. The objective of the whole study is to evaluate the level of patient satisfaction with Hep C treatment at DHQ Hospital, Kotri, and identify the factors influencing the satisfaction. Methodology. This was a descriptive cross-sectional study conducted between the January to May 2025. Total 150 patients were observed who have completed their antiviral therapy. The sampling we used was the convenience sampling, and data was collected by using validated patient satisfaction questionnaire with the 5 key domains: access to care, physician, communication, drug availability, counseling, and side effect management. The data was analyzed by using the SPSS version 26. Now let's come to the demographics. Out of 150 patients, 58% were males and 42% were females, residing 66% rural population and 34% urban population, with a mean age of 41.2 years with a standard deviation of 11.8 years. All the patients' age was ranging from 22 to 68 years. It means that all of them were of middle age. Out of 150 patients, 78% were satisfied with the whole treatment experience. Breaking the domain down by domains, the doctor-patient interaction scored the highest with 85%, medication access 81%, counseling and education 72%, follow-up and lab facilities 62%. Not whole study was perfect, but there were certain dissatisfaction. About 22% were dissatisfied because of the delay in the lab facilities and follow-up care. Now let's come to results. We also examined the association between the treatment and clinical outcomes. The two key associations were treatment adherence and satisfaction with a p-value of 0.003 and sustained viral response achievement and satisfaction with a p-value of 0.001. Now let's come to discussion. All of our patients were highly satisfied with the treatment services at the DHQ Hospital Kotri with the strongest domain, physician-patient communication and drug availability. The challenges we faced during the whole study was delays in the lab services and counseling gaps. All of our findings align with international evidence on the patient-centered care. To be concluded, Hep C treatment satisfaction is high at DHQ Hospital Kotri. Our recommendations are to improve the lab service efficiency, strengthening counseling and follow-up care, enhance patient-centered communication. We also faced certain limitations that it was a single-center study and with a convenient sampling which limited generalizability and objective treatment outcomes. And our future directions are that it must be the multi-center studies and also the qualitative interviews with the patients so that we also have their perspective. In the last, I would like to acknowledge the DHQ Hospital Kotri staff and patients for their whole collaboration. Now, thank you for your attention. I will be answering any queries.
That was a very engaging presentation. We'll quickly move to our question and answer session. If any of the students want to ask any questions from our presenters, any questions?
The more questions should be from the student side, because the whole event is being arranged for you people. So you should take an active part in question and answer session. And every question is welcome over here. Come on.
Do we have any questions from the students? It is an interactive session and we expect you to participate. Okay. So ladies and gentlemen, we have just witnessed such a wonderful session where our young researchers showcased their talent, creativity, and hard work. Each presentation reflected critical thinking and a promise of future leaders. I extend my heartfelt congratulations to all the presenters for their effort. Now I would like to request our respected chairs, Professor Munawar Alam Ansari, Professor Shamsul Arfin, and Professor Salman Shafiq to kindly share their concluding remarks. Sir.
Thank you, Dr. Madiha. Thank you very much. You see, I'm really very happy to see all of you over here. And I must congratulate all the students who came here, stand here, and they present their research. And I must congratulate all of you who present there and listen their presentations. So it's not an easy job. At the undergraduate level, right from very first semester up to the last semester, it's really very difficult. I do realize, and I must realize, that how it's difficult to do some research. Whatever the level of the research is immaterial. But how you come, present your research is very important. So today, I'm really very happy being a teacher that my students are now on a very right track, and I must congratulate all of you. All of you. Thank you, beta.
First, thank you very much for inviting me as a panelist in this session, and all the organizing committee, especially the Vice Chancellor, Professor Dr. Ikramuddin Ujjan Sahab. Dr. Manzurullah Khair and Dr. Khalda Sheikh. And I also congratulate these types of conferences, and this was especially the named Murc for the medical undergraduate student research. And I think this was a great effort by the organizers and by the students as well. And now the medical education has providing a lot of opportunities to the students, undergraduate students of the medical and dental side for performing their research. And I have seen these 5 to 6 presentations. They are marvelous. They have worked a lot, and they have the courage to present these researchers on desk, and they come over the dais and present. It is really wonderful. There are some few lacunas and deficiencies, but I think overall it's a great movement for the students as well. And I chair this session. Our worthy Chancellor, Professor Dr. Syed Razi Muhammad, have yesterday a lecture on the theme talk, and he arrived last night and have a theme talk. And with me, there are also 4 professors are also invited from the Ibn Sina University, Muhammad Medical College, Mirpokhal. So in last, I am again thankful for all of you for inviting me, and congratulate you arranging this conference as well. Thank you very much.
Thank you very much, sir. Yes, please, sir.
Okay, fine. जो मेरे co-chairs ने क्या है वो copy paste कर दीजिए. Anyway, तो believe me, it was like first drop of rain, you know, वो वाला feel आ रहा है. Because मैं यहीं इसी institute का graduate हूँ, तो उस इंस्टीट्यूट में वापस आना एज ए यू नो इन अ हायर कैपेसिटी, उसके बाद फिर अपने जूनियर्स को देखना कि वो काम जो हमने कभी तसव्वुर भी नहीं किया था, हमें तो रिसर्च का आर भी नहीं पता था, और यहाँ पे आके फिर उन रिसर्चेस को देखना जिसमें इतनी डाइवर्सिटी है, इतना एफर्ट है, और फिर के कंट्रीब्यूशन इतने डिफरेंट इंस्टीट्यूट्स के, इट वाज सच अ सेटिस्फाइंग एंड प्राइड मोमेंट फॉर मी एज अ टीचर. And congratulations to the organizers and university for being pioneer in this region, starting this initiative, and I'm sure this will lay down a foundation for the future researches as well. Thank you so much.
Thank you very much, sir, for your wonderful words. May I now request our esteemed dignitaries, Professor Ashok Kumar Narsani, the Dean of Surgery and Allied Sciences, and Dr. Nazia Mumtaz, who is the core chairperson of organizing committee, to please come forward. And I would also request the chairs for our today's session to please grace the stage for certificate distribution. I'll call upon each presenter to receive their certificate one by one. Hamna Sheikh from Lumhs. Dua Nadeem Akhtar from Muhammad Medical and Dental, Ibn Sina University. Dua Nadeem Akhtar from Muhammad Medical and Dental College, Ibn Sina University. Alina Zaira from Khairpur Medical College, Khairpur Miras. Sumaya Maqsood from Lumhs. Students have left. Mahnoor Umrani from Isra University. Muhammad Amar Ilyas from Indus Medical College. Abdul Qudus Mehman from Bilawal Medical College. Exactly. To acknowledge and appreciate the time and the effort of our esteemed chairs, I now request our dignitaries to kindly present shields as a token of appreciation and gratitude to our chairs. Sir, Professor Munawar Alam Ansari, please receive your memento as a token of appreciation. Professor Shamsul Arfin to receive his memento from our dignitaries. And Professor Salman Shafiq to please receive his memento as a token of appreciation and respect. It is time for me as a moderator to receive my memento. Thank you very much everyone for your participation and have a nice day.
Thank you so much, chairs and moderator. We now move forward to a highly anticipated segment of this conference, the panel discussion. Panel discussions are important as they enhance student academic and professional knowledge, preparing them for the future roles in medical research and healthcare leadership. This panel discussion will cover various aspects of medical research, including bench sciences, clinical trials, community health, and digital medicine, promoting a comprehensive understanding of healthcare challenges and opportunities for undergraduate students. To guide this stimulating discussion, I now invite the moderator for the session, Dr. Hudaybiya Alabaksh, in charge, Department of Medical Education, to take the stage.
I have to make an announcement. The winners for today's session would be announced tomorrow at the concluding session, which will be held tomorrow morning. Thank you very much.
नहीं बाबा, ये देखो मैं भी भेज दूँ तुम्हें पीपीटी में। Okay, Assalamu alaikum everyone, and a very warm welcome to all of you. I am delighted to be your moderator for today's panel discussion. Let me introduce our panelists for today's discussion. Now, Professor Dr. Saima Zainab. She is a professor of community medicine and in charge undergraduate research at Liaquat National Hospital. Then we have Professor Asad Ali Khan, professor of community medicine and head of department and undergraduate research at Fazaiya Rutfao Medical College. Then we have Professor Shahid Hussain Sumro. He is a professor and chairperson of anatomy at Larkana and also director academics as well. And our next panelist is Dr. Farooq. He is associate professor and director research at Khairpur Medical College. Then we have Dr. Salma Rati. She is associate professor, College of Nursing at Khan University Hospital. Last but not the least, Professor Dr. Banafsha Manzoor. She is a director, Medical Research Center and director, Murc-Lumhs. Now I would like all the panelists to join me at the stage. Yes. Achha, one more. And also I would like to invite Dr. Fawzia Ali. She is a professor at University of Alberta, Canada. Please join us, everyone. Thank you very much. The theme of our discussion, that is breaking barriers, overcoming challenges of undergraduate students in research, is both timely and important. Undergraduate research not only develops critical thinking and problem-solving skills, but also prepares students to become future innovators and leaders in healthcare. I want to open this panel discussion by the first question from Dr. Farooq. What are the biggest challenges undergraduate students face when engaging research?
What are the biggest challenges in undergraduate research? ये एक बहुत इम्पोर्टेंट क्वेश्चन है. अगर अंडरग्रेजुएट जो स्टूडेंट्स हैं उनको हम सबसे बड़ा चैलेंज जो मेरी नज़र में है वो ये है कि हम स्टूडेंट्स की गाइडेंस और लैक ऑफ अवेयरनेस है. अगर हम स्टूडेंट्स को गाइड करते हैं तो उनके पास बहुत बड़ा एक पोटेंशियल होता है. उनको हम एक प्लेटफॉर्म देते हैं, ओरिएंटेशन देते हैं और उनको अवेयरनेस देते हैं तो ये बहुत बड़ा प्लेटफॉर्म है. लेकिन ये स्टूडेंट्स को हम फर्स्ट ईयर टू फाइनल ईयर हमारी गाइडेंस मिस होती है. हम समझ नहीं पाते कि अंडर ग्रेजुएट रिसर्च बहुत बड़ा एसेंशियल कंपोनेंट है, उसको हम मिस कर देते हैं और हमें पता ही नहीं चलता कि स्टूडेंट्स में कितना बड़ा इनसाइड एक स्किल है रिसर्च का, जिसको हम एट द एंड फाइनल ईयर तक भी रियलाइज़ नहीं करते. दूसरा जो बड़ा चैलेंज है मेरी नज़र में अंडर ग्रेजुएट रिसर्च में वो है इंस्टीट्यूशनल बैरियर. जो हम जिस इंस्टीट्यूशन में काम करते हैं वहाँ पे जो रिसर्च डिपार्टमेंट है या रिसर्च के जो हेड हैं उनके हवाले से हम स्टूडेंट्स को डेटा एक्सेस नहीं दे पाते, लैब्स में एक्सेस नहीं दे सकते, कंप्यूटर स्किल्स में हम उनको नहीं गाइड कर सकते. और एक इंस्टीट्यूशन है वो नेशनल कॉन्फ्रेंसेस, जितनी इतनी बड़ी कॉन्फ्रेंस ऑर्गेनाइज हुई है, इंटरनेशनल कॉन्फ्रेंसेस ऑर्गेनाइज होती हैं तो इंस्टीट्यूशन उनको इजी एक्सेस नहीं देता, परमिट नहीं करता या उनके अदर इश्यूज़ होते हैं. तो एक इंस्टीट्यूशनल बैरियर इज़ वन ऑफ द बिगेस्ट चैलेंज. थर्ड पे अगर हम आते हैं तो फिर रिसोर्सेज और फंडिंग के इश्यूज़ होते हैं। एक इंस्टीट्यूशन के लिए लिमिटेड रिसोर्सेज होते हैं और उनकी रिसर्च डिपार्टमेंट में डेडिकेटेड फंड्स जो होने चाहिए वो फंड्स नहीं होते। एक डेडिकेटेड जो बायोस्टैटिशियन स्टाफ है उनके इश्यूज़ आ जाते हैं। उनके बाद मेंटोरशिप है टीचर्स की, जो बेसिक साइंसेस के टीचर हैं फर्स्ट ईयर से फाइनल ईयर तक, उनको क्लिनिकल प्रैक्टिसेस पे या फॉर्मल सब्जेक्ट्स पे ज़्यादा फोकस किया जाता है। हम उनको बताते ही नहीं है कि जो हॉस्पिटल का डेटा है, पेशेंट का डेटा है, डेटा कलेक्शन है, क्वेश्चनियर है, इसकी क्या इम्पोर्टेंस है। आज की दुनिया में इन चीज़ों पे कितना फोकस होता है कंटेम्प्रेरी वर्ल्ड में। तो मेंटोरशिप जो है ये भी बहुत बड़ा चैलेंज है। फिर स्टूडेंट्स का एक टाइम कंस्ट्रेंट्स आता है, अपने उनके टेस्ट होते हैं, कॉम्प्री होते हैं, एग्ज़ाम्स होते हैं, ये भी एक चैलेंज है। उन सब को रिसर्च के साथ चलाना होता है। तो मेरी नज़र में दीज आर द बिगेस्ट चैलेंज इन अंडर ग्रेजुएट रिसर्च।
Thank you so much, sir, for enlightenments. Now I would like to pose my second question to Dr. Shahid. Do undergraduate students feel adequately trained in research methodology, critical appraisal, and writing?
Thank you, Devya. So before replying your question, I would like to congratulate the Vice Chancellor, LUMS, Professor Dr. Murc-Lumhs Sahab, Professor Dr. Manzoor Ali Lateef Sahab, and whole the organizing team of this scientific symposium conference for arranging such a wonderful conference. And theme they have choose for this was really wonderful, to involve the undergraduate in the research. So now I would like to reply whether the undergraduates are adequate in knowledge regarding the research. So if I talk the previously, before the induction of modular system, so newly inducted student, even up to the third year, they were not aware regarding the research. Okay, what is our research, how it should be done, how can we, and they were, even when we were a student, we were having no knowledge regarding the research, what is this, how this can be done only in this one. But now, after the modular systems, when it has been introduced in the curriculum, now we are teaching the students from the first year, okay, what is research, what is this different methods, what is the different ways, sampling techniques, everything we start from the first year. So I feel those students who are interested in, they learn a lot from this. But as my friend he said, mentorship is also a problem. As I told you previously, there was lacking of these research in the faculty. Even our faculty, senior faculty, these are less aware regarding research, especially if I would like to talk regarding the basic side. So they are very much in deficit in this era. So they also need to improve so that they can taught their students. But I feel now students which are going to induct in the first year, they are contacting us, sir, we want to research, we want to do something, and this is very important. And from today's morning session in free papers, I realized that students have potential, they are willing to do something. When they will got some proper guidance, they can do many things. But again, which is the more important thing, which is also the theme of this conference, from bench to base side. Now we have seen the many conclusions, many research they have presented, many conclusions, this should be done, this should be done. But this should not be limited up to the papers, up to this hall. But it should be translated in the things so that our community can get benefit from these. Thank you very much.
Thank you so much, Professor Shahid, for such an enlightful answer. Now I would like to pose another question to Professor Sonia Zainab. How can universities build a research-friendly environment, especially for the undergraduate students?
Assalamu alaikum. Very nice question. I'll give a detailed answer to this question. Universities can do many things. The first one, skills development. Skill development means faculty development for conducting the research among the students. And then skill development among the students as well. With proper training of research methodology, all steps, balancing the research with their routine teaching in all aspects, like in undergraduate medical student as well as allied health sciences. Then providing them with structure mentorship program. With structure, I means regular meetings with their mentor as well as receiving the feedback from their mentor as well. And working on that feedback and improving their research. Then universities can secure funds for the research, undergraduate research. They should invest in information technology, provide latest software to the students, make them accessible to the students, provide them laboratory services for their researches, and connecting their research with the international problems like sustainable development goals, environmental problems, and human issues like we are witnessing many international migrations and in-migrations. So apart from that, universities must collaborate with other institutions for the support of student research. These institutions could be medical students, medical organizations or other organizations. So there are many things universities can do on their part to enhance the research culture and research paper development in institutes.
Thank you so much, madam. Now we'll move to our next question. This question I'm going to ask from Dr. Salma Ratni. How can interprofessional collaboration, that is medical, dental, nursing and allied health sciences, enhance research opportunities?
Ji, Assalamu alaikum. This is one of the important and excellent question. I think when we are talking about research, healthcare field itself is not one domain. It's a medical, nursing, allied health. All the professions are coming as a part of. So it is very, very important. A research question is to be seen throughout, like what is how, for example, if you are seeing that a patient with the diabetes, so what are the things which are important? So, so starting from the type of the quality of life, the socio-economical determinants of life, how the overall profile of the of an individual and the family that person is coming from is impacting or influencing the overall disease process. And then lab investigation. So for example, I'll just give one example. If you are saying that the lab investigation is to be done, then we have to see that if the lab was prescribed according to the need or not. Here, for example, if you are saying if a physician is prescribing that you go for a one glucose test, so if glucose test, patient is just told to come for the test, but he is not telling, he or she is not telling come for the fasting, and patient is coming with the random, like after taking the breakfast. So even like this, as per says, those who are sitting here may think that what is she talking about, but if there was like not being informed about fasting, and if the sugar level is coming high, so then this can go to the misdiagnosis and then mistreatment, and then overall profile of the patient will be impacting. So if you see from the admission of the patient coming to the clinic till the time he or she is entering to the physician and then prescribing the diagnostic test, performing the diagnostic test by the lab, and the lab value that is coming according to age. So if the age is not being given correctly, so maybe the age of 28 years old is different, the reference rates of the of the sugar level will be different for the 28 years than the 42 years. So these are few of the examples which are coming on a daily basis, and accordingly if you prescribe the medication, what are the medications? So we can see it is like coming from the physician, the laboratories, the nurse who is explaining, and then the pharmacist who is prescribing. If you are having the pharmacy, medication is being supplied. So this is a chain of the communication, chain of the command, or the chain which is basically impacting. So when you are thinking about research, like I just heard few of the here. So when the presenter was talking about stress level and the migraine, so what is the stress level over here? So is it like faculty is giving the tension, or the problem is in the environment? So who is basically to be looked into? It is not only the individual, the environment person is coming. So we can see that it is not one thing. One wheel is basically impacting on the other wheel. So you cannot see from the one lens. We have to see how the overall, the global picture of the research that is important. How everybody is connecting in the chain of command, that is very, very important. Thank you.
Thank you so much. Let me welcome Professor Asad Ali Khan Saab. He is a professor of community medicine at Fazaya Power Medical College. Thank you so much, sir, for joining us. Now I would like to pose another question to Dr. Fawzia. Can undergraduate research contribute meaningfully to addressing local and global health challenges?
Thank you very much. I hope I am audible enough, because there is so much sound coming and the echo. Okay, the question is, how can we relate the undergraduate research to the context? Now, what is important is most of the books and most of the research which are done globally, we tend to take the result and implement those outcomes in our context, and those are not relevant to where we belong to. So I'm bringing a context where I have been practicing. So I'm just sharing some of the example that when I migrated to Canada, what I had in my curriculum taught to me in regard to the healthcare outcomes, when I went to another country, those were not similar. So what we are talking about is the global context is important, and when we talk about evidence-based research and the practice, that has to be contextual, relevant to your context. So according to the question, are undergraduate research relevant? Yes, they can be relevant, provided they are being done with rigor, with integrity. There is, like, lots of people talk about mentorship, the relevancy of methodology. So all those things are very important to put all those things into a place. So the final conclusion is what undergraduate or anybody who talks about research, I just wanted to even highlight when the first question came, what are the barriers for research? We usually see research as something very difficult, complex, because we are not being exposed. The second speaker talked about that now research is being introduced into the curriculum because we need it. We need to prove and to make our practices contextually based on our people who are living in this context. So the final is, yes, the undergraduate make a lot of contribution and keep on doing it. The other thing somebody said, when you do research, please make sure to publish those research so that they can be used. Okay, so implementation, dissemination is another important criteria of research. If you do research and it's on your shelf, it is of no use. Okay, so I hope I answered your question.
Yes, madam. Thank you very much. Now I would like to pose a question to Professor Binafsha Manzoor. How important is the role of faculty mentors in encouraging undergraduates to take part in research?
Thank you very much, Udavia. And I really appreciate efforts of organizing committee and everyone who took part in organizing such august platform, and also giving opportunity to our undergraduate students. It is very important, when I ask question from our students, what is research? So their answer is it's a journey from known to unknown. So, when you are going for some unknown journey, guide is very important. And research is something where you are learning so many things. And in research, each project is different. Even if you are doing a simple cohort study, each variable has its different nature. So its collection, its analysis, its interpretation is different. So when you are doing a project, you need a guide to take you through that journey, from designing of a study till publication. And when we realized this, that we need mentors who can guide our undergraduate students, so 3 or 4 years back, we started this mentorship program in LUMS, where all our undergraduate students are assigned a mentor from our faculty who are also trained in research. These faculty members are trained in research and they have interest in research, because research के लिए वो कहते हैं ना, ये वो नगमा है जो हर साज पे गाया नहीं जाता. So research can only be done by the people who are keen to explore new things. So from within faculty, we choose members who are interested in doing research. Then there was also implementation of incorporating research as a subject at undergrad level. Then there was an issue that who's going to teach, because research departments are established everywhere in almost all universities, but we do not have that number of faculty members who can teach research as a subject. When we looked at the international forums and research-intensive universities, they offer academic programs, degree programs in research. So LUMS is the first university in Pakistan to launch Masters in Medical Research that is accredited by Higher Education Commission of Pakistan as a level 7 qualification equal to MPhil. Now our first batch is in process. When these graduates will come in the market, they will be the resource for all our medical colleges and universities to teach research as a subject. And I think I try to answer the question that how mentorship is important. Then again, I emphasize that not only at undergrad level, but also at postgraduate, doctorate, and postdoctorate level, mentorship is essential. Thank you very much.
Thank you so much, madam. Now I would like to pose question to Dr. Asad, who has recently joined us. To what extent does the academic workload discourage students from pursuing research opportunities?
It's true that workload is definitely a reason that students are not into the research, but I think there is a solution to that if the programs are structured into the curriculum, then it can solve the problems. The problems will always be there. I mean, academic workload, research should be a part of that academics. Otherwise, in order to have a separate slots for research, that can also be done, and ideally research should be institutionalized. The institution should take initiative to inculcate research attitudes among the students, and that workload can be lessened in that way. And otherwise, obstacles will be there. The students mostly think that we need some other time. We need extra time for the research, which is very difficult. Along, for example, if this is the talk about undergrads, let me talk about the postgrads or the PhD students, which have a lot of work to do. But even then, the obstacles will be there, but you have to navigate through these obstacles, and workload is one of the obstacles for undergrads. So, I mean, there has to be some way institutional assistance as well as students' own aptitude for that. Thank you.
Thank you so much, sir. Now I would like to give the opportunity to my all students. If they have any of the questions, they can ask from our panelists. Please give the mic.
Thank you, madam. My name is Professor Hussain Baksh Kolachi, and I have heard all the researchers and professors. The research is now coming down from undergraduate to community level. And madam from Alberta will know that now the universities are asking topics from the community, that what problems, what solutions they require, and university is part of the community, not the community is part of the university. So what my conclusion is that the inter or multi-center research is missing in Sindh. We have at least 10, 12 universities. If they will combine undergraduate, postgraduate, community research, I think the speed as well as the quantity, quality, and relevance will improve. Thank you very much.
Yeah, please, ma'am.
Okay. There are two, we would respond to it. And what we are highlighting and what I hear is the need for multi-sectorial and multidisciplinary to be included. And yes, globally we need to do research as a partners, and the skills and knowledge could come across, because what we need is the skills can come from one place, the resources can come into another place, and somebody who put forward that there is a need for community health research and global health and the sustainable goals integrated in research to make a better informed policy implementation. So what we are looking to is the research is to guide us the practices, and we need to do those things, and it's doable provided we have partners with other universities. And what we take is what is relevant to our context, and they would share what is relevant to them. And there are lots of places where research are being done globally. So my colleague wanted to share something.
Thank you. It was a very nice question from the Mr. Kolachi Sahab. That's why we are agree with you that research what we are doing at the universities level, we should also involve the community, because research, it means where is the problem, where is the gap, because already many researches are going on, being conducted already, but always when we choose a topic, we see the gap, where is the gap and how to fulfill. And this gap, from where it comes from the community. And the peoples from community, they know the problems well than us. So when we will go to there, we will involve them, we will ask from there what is their problem, to find out their solution, then we can do anything. And then we will recommend what things should be implemented to solve this problem. Now one thing that I want to share, that Higher Education Commission is also asked the universities to hold the community-based outreach programs, so that we can go there, help there, sort out their problems, and get the questions which help in our research to improve to the higher level. Thank you very much.
Thank you so much, sir. Okay, audience, my dear students, if you have any questions, so this is liberty for all of you. If you want to question, please ask questions.
There is one, excuse me, there is one comment I would like
Sure,
to,
sir, sure.
I would like to add what Dr. Kolachi, Professor Kolachi and sir has said about the community, involvement of community in the health initiatives and different aspects. Obviously we take communities, it's a major stakeholder, but I think that the doctors or the clinicians, they should also be the part of this process, because they all are the stakeholders. And one thing that the students also, undergrad students also thinks to know, is that the health exists outside the boundaries of hospitals. It's the community from which the cases are coming. So we need to focus our major efforts towards the activities that are taking place outside of these hospital walls. Thank you, sir.
Thank you so much, sir. Yes, audience, especially my dear students, if you have any question.
हेलो सर, अस्सलाम वालेकुम सर। अगर हम क्वेश्चन ये है हमारा कि अगर हम रिसर्च करना चाहें तो हमारा बेसिक कहाँ से स्टार्ट करें, ये कन्फ्यूजन होती है रिसर्च में, तो इसका थोड़ा बताएं सर।
Okay, I will take this question. If you want to do research, you are very much motivated, and your institute must encourage you to conduct research. First of all, you have to do the literature search. You must know how to do a extensive literature search. And after doing the literature, you must identify your topic. And that topic is applicable to your community and your environment as well. It is very important to do the research that is beneficial to your community and your society. And then identify your mentor who is going to guide you throughout your research project. Once you have done your research, please publish it. As it is mentioned earlier, publication is very important, or dissemination of your finding is very important. So the first step is always finding a good topic. The topics which are being considered very good these days are which are in connection with the international topics. Identify the topics which are in relevance to sustainable development goals, environmental problems, maternal health, child health. So these are the topics which are very, very much considered as a hot cake in terms of publication, as well as the single center. I'll add to the comments on Dr. Kolachi. Single center studies are getting difficulty in being published. So many journals are encouraging, or they are publishing the multi-center studies. So if you're doing from a single center study, the chances of publications are very low. So if you are planning your researches, make it on 2 or 3 or 5 centers, not as on a single center. So you will not get published your research at international forum or at a good journal. Okay?
Thank you, madam.
I want to add something to this question. Are you from LUMS? Okay, even Bilawal, Dr. Sharik regularly takes your classes on research, biostats. So, and as a part of your degree program, you have to do a research project and get it published. For that, we also provide you mentors. So that is your training. In addition to that, if you want to do an additional project, then Medical Research Center is there to encourage all students to do research. But it's my suggestion to all students, because when undergraduate students, they want to do a project, they just want research overnight. And sometimes they just send their project at 2 a.m. at night, and in the morning, 9 a.m., they come that give us feedback. This is not possible, because undergrad research is very, very important for us. But again, we have other assignments. So give all your mentors some time to go through it, because we have some good quality time to go through those projects. Then once it's done, in addition to the required project that you have to do as your degree program, I'm talking about additional thing. Then what kind of project you want to do, see if it is feasible and at your level. Like some students, they come and say, we want to do research on microRNAs. Okay, you can do it, but do you have expertise to do that? And they are not ready to take somebody else as part of their mentorship. Then you have to look at those things, what are your expertise at this level, because you are learning. So you need to do a small project, or you may join a senior MPhil student or a PhD student and support them, learn those techniques, and you will be author in their publication when they complete their project, certainly. But during that journey, you are going to learn those techniques. So when you become expert in that, you can develop your own study. So this is how you can start. Thank you.
Thank you, Dr. Banafsha. Now, Dr.
Ms. Udevia, Dr. Udevia, can I reply? Oh, thank you. So, Dr. Saab, first of all, I would like to appreciate you for asking question. And your question was from where, how do we start the research from? So, this you have started research. When question comes in mind, this is the research. This is the start of research. Being a medical student, beta, you start from simple things. Suppose अगर आप देख रहे हैं कि if you want to see how many students are going to fail in the annual examination, this is your research. Why students are not getting interest in some lecture, this is your research. So basically, where there is a gap, the question we want to ask why, where, how, these are the research. And big I student, you start from the simple things as your level, your survey, assessment, prevalence, incidence, start from this. Then if you have enough knowledge, you get our expertise in these things, then you can move to the lab experimental research as well. Thank you very much.
Ji sir.
Sir, Shah Saab is rightly answered and Mentfosia. I would add something. If you are a student, how to start in research. This is very simple. When you are studying in any college, in an institution, you are surrounded by many researchers, but you don't know. When you meet them, interact them, you try, you will find number of researchers. And other than this, sir has commented already, when you are interested, your interest is keen in morbidity, mortality and public health concepts, prevalence and incidence of diseases. You see first you should go in, this world is an open, we are the global citizen. We are acting as a national citizen and global citizen. You should go to the websites. The ResearchGate is one of the wonderful websites where I first experienced my research things. Should go log into ResearchGate, make your ID through your institution. You would have an IT department. You should go to academia. It's one of the second most famous link in the world. This is free of cost. And you can join Google Scholar as a student. You will see number of things. Last night I see is very amazingly, one of the student of final year, Muhammad Owais, is published 21 research paper. And it is one of the great news that we see scholars in your university, they are getting published. He said that first I got motivation for research through LinkedIn. And I have been connected LinkedIn since my second year MBBS. So use these forums. These are for you. And students globally connected through these all AI tools, as last night Vice Chancellor told. So you should have number of ways to interact, to see number of public health things, research, concepts through your IT and through your institution. Thank you.
Ji, Dr. Munawwar Alam Ansari, you wanted to say something.
Thank you very much, Dr.
Dr. Hudaybiya, I would like to, sir, if I may add to what Professor Banafsha has already said. If you want to do the research, then obviously it's a grilling process, it's an uphill task, but it's also rewarding. And you can't do it alone. You have to take your mentors along with you. And most of the students just like ask that from where to start the research. And she has very rightly that you have to look at the feasibility, whether you can do it or not, microRNAs, but you can't do it. If you have the capacity to do it, do it. Other thing is that instead of right now jumping into doing the research, it's better if you can start writing or at least reading the case reports, right? The case series. Even if you're writing letter to the editor, at least it will sensitize you with the process of the research, and that may lead and that should lead towards the other ideas and research. Thanks.
Thank you very much, sir.
Thank you, sir. Thank you very much. Rather, there's no question, but slight comment, because I'm really enjoying the very intellectual discussion on research, and on the behalf of Liaquat University of Medical and Health Sciences, I must welcome all my guest panelists. You see, there are a few questions which has been raised by Kolachi Saab and some panelists. One is the funding. Sir, now we use the hunting of the funding, and it depends on the potential of our project, number one. So if you have a potential project, you will get the funding easily, because there are so many funding agencies now. So I think there is no any problem as far as the funding is concerned. Number two, now the dimensions of the research is being changed in the Pakistan. Now how the dimensions are being changed, now we are changing to the multidisciplinary, multi-centered research. In Pakistan, there are so many projects, they are on the way, they are the multi-centered and with the collaboration of the international organizations. So this is a very positive thing. And the question was raised by somebody that how we start the research. So the research is nothing but the critical thinking. If you have the critical thinking, that is the first step to start the research. Thank you very much, sir. Thank you very much.
Thank you very much. Please, we have any other question? Yes, please.
Assalamu alaikum. I am Samreen Khan from BS Radiology College of Technology at Lumhs. My question is that obviously हम लोग रिसर्च की बात कर रहे हैं, तो मेरा सवाल ये है कि रिसर्च स्टार्ट करने के लिए बेसिक स्किल्स क्या होनी चाहिए, और उसके बाद जो है रिसर्च बनाते हैं स्टूडेंट्स, उसके अंदर जो बेसिक मिस्टेक्स होती हैं वो क्या होती हैं कि जो अगर फर्दर स्टूडेंट स्टार्ट करना चाहे रिसर्च तो उसको अवॉइड करें. थैंक यू.
बेसिक स्किल्स जैसे मुनव्वर साहब ने कहा कि यू नीड क्रिटिकल थिंकिंग. आपको जो नीड है, जहाँ पे आपको रिसर्च करनी चाहिए, यू नीड टू आइडेंटिफाई दैट एरिया. First, because you need to ask yourself what makes you interested in research. Because when you're doing a project, obviously you are going to publish it. तो next project करने के लिए आप जाएंगे तो आपकी expertise देखी जाएंगी. जैसे आप अगर अंडरग्रेड में एक रिसर्च प्रोजेक्ट करके आए हैं, पोस्ट ग्रेजुएट में आप किसी मेंटोर को ढूंढ रहे हैं, तो वी लुक एट योर एक्सपर्टीज़ कि आपने पहले किस चीज़ पे काम किया है. सो इट्स लाइकली दैट यू आर गोइंग टू लिव विद दैट रिसर्च एरिया फॉर रेस्ट ऑफ योर लाइफ. So ask yourself if you are interested in that research area or not. Then you must have some academic writing skills, and you know these are skills. So आप वो सीख सकते हैं. And regularly Lumhs में workshops होती हैं, trainings होती हैं, medical research center में regularly trainings होती हैं, and we also provide some fellowships as well, जहाँ पे undergrad students can join us and even they stay with us for years and years. Even during their undergrad program, but we need your commitment. इसके लिए we train you in critical thinking, in academic writing, in analysis, interpretation, और language पे आपने खुद काम करना है, because we write in English and we understand that we are not native English speakers. उसके लिए बहुत सारे softwares हैं, but again you need to learn it. और जो common mistakes students करते हैं, जो मैंने ऑब्जर्व किया है, दे बिकम ओवर एक्साइटेड कि वो पहले ही दिन चाहते हैं कि हम बिल्कुल ग्राउंड ब्रेकिंग रिसर्च कर लें जिसमें हमें नोबेल प्राइज़ मिले. दिस इज़ नॉट पॉसिबल. यू हैव टू स्टार्ट फ्रॉम स्मॉल थिंग्स, डेवलप योर एक्सपर्टीज़, देन टेक वन स्टेप, देन नेक्स्ट स्टेप, देन नेक्स्ट स्टेप. और दूसरा ये कि स्टूडेंट गेट ईजीली डिस्करेज्ड. अगर डेटा कलेक्शन में 2 महीने लग रहे हैं तो उनको लग रहा है कि ये हमारा काम 1 हफ्ते में हो जाना चाहिए. So research needs patience, which is very important, because sometimes projects takes 5 years, 10 years. और when you are starting a project, तो आपको उसमें जितने hurdles आने हैं वो भी जहन में रखने हैं. You have to discuss it with mentors. और दूसरी जो student की mistake हमेशा वो मेरे पास भी आते हैं उसके लिए कि they need funds. हमारे पास funds हैं, and उसी के लिए we make your mentor as a principal investigator of that project, because that will remain custodian of that data and also the funding. We have our own resources, our own funds for students, but again your mentor is going to apply as a principal investigator. तो student को ये होता है कि mentor is leading the project, तो मैं कहाँ हूँ. You will become first author, you will have your expertise, but because when we are giving fundings, we need someone who's responsible and answerable to university. So you need skills, you need to improve your language, and you need to develop patience.
Madam Binafsha added very much regarding the skill which should you know for doing the research and writing a good article which is very acceptable for the publication. But I want to add one thing. If you want to do research, intention is first point which should be in you. आप में ये जज्बा होना चाहिए कि मुझे कुछ करना है. ये मत सोचें कि मुझे इंग्लिश राइटिंग आ रही है, मेरे पास कोई रेफरेंस राइटिंग की स्किल है नहीं है. You should start. First, if you don't have anything, any question is coming in your mind, or even no, you are intended to do a research, go to your seniors, your mentors, which are involved in the research, and ask them, sir, I want to do something, give me some task. So they will guide you. They will give you the part of research which can be in the form of pro formas or collection of data through other tools, and by this you will take a start, and then bit by bit you will learn. Further, I would like to suggest that you go through the articles, published data, so that you will get the knowledge how they have write the article, and then your data which you have collected or you are going to collect, you will collect accordingly, and will know how to interpret this and convert into the article. Thank you.
Okay, now I would like to take the last question from the audience, as we have very limited time and I know you all are very eager to learn and want to ask a lot of questions, but due to shortage of time, I would I can take only one question from the audience. So last question from the audience, please.
अस्सलाम वालेकुम एवरीवन. मेरा क्वेश्चन ये है कि जैसे हम लोग सुन रहे हैं कि पीएमडीसी ने पासिंग क्राइटेरिया 50 to 65% रेज़ करने की सजेशन दी है एंड अटेंडेंस क्राइटेरिया to 85%. तो इन हालात में क्या अंडर ग्रेजुएट के लिए ये चीज़ पॉसिबल है कि वो एक गुड रिसर्च कर सके इन अ लिमिटेड पीरियड ऑफ टाइम? And the other thing is that for postgraduate people, doctors, के वार्ड्स की ड्यूटीज़ 48 आवर्स तक भी होती हैं इन अ वीक. तो क्या उनके लिए ये चीज़ पॉसिबल है कि वो एक रिसर्च के लिए डाटा कलेक्ट करें और फिर मैन्युस्क्रिप्ट लिखें एंड ऑल द अदर थिंग्स? व्हाट डू यू थिंक अबाउट दैट?
एज अ डायरेक्टर मेडिकल रिसर्च सेंटर, क्योंकि पीएमडीसी ने जब ये किया था तो पीएमडीसी ने उसके साथ रिसर्च टीचिंग भी मैंडेटरी कर दी है. एंड it's not just research teaching, but you have to do a research project as well in a group. So again I'm repeating कि आपने वो चीज़ें नहीं करनी है जिसमें आपकी expertise नहीं है. You have to do simple things again under mentorship. तो उसमें अगर आपका data है 100 samples का and you are 5 in the group, तो आपको उसमें कितना time लगेगा? It won't take that much time. And again you have 5 years to complete that project. So I think it's absolutely doable. And you know, when you talk about research intensive universities, आप ऑक्सफोर्ड यूनिवर्सिटी का एग्जाम्पल ले लें, तो वहाँ पे कभी आप स्टूडेंट्स को you won't see them just wandering around doing nothing. They are always involved in research and teaching. So when you are a student, you have to have that thinking in your mind. पूरी दुनिया में जब स्टूडेंट्स करते हैं तो यहाँ पे क्यों नहीं कर सकते? You have to manage your time well, then it's absolutely doable. Second thing, for postgraduates, it's mandatory for them to do research project. और उनके लिए if you go to LUMS website, तो हमारे पास postgraduate का पूरा research curriculum है जिनके उनके पूरा time frame दिया हुआ है कि if they are 2 years degree program, how they are going to manage their time, when they have to do their synopsis writing training, when they have to submit their research proposal, by what time they have to get your proposal approved, and then when they start collecting their data, what time is required for the data collection, and at the end how they are going to write thesis. और इसमें I always say, if you give just 30 minutes a day for your research project and research work, you will complete it within time. 30 minutes a day. तो आप 24 hours में से 30 minutes research को नहीं दे सकते. 24 hours में से 30 minutes research को देने के लिए कौन कौन रेडी है आप में से? तो आप सबके प्रोजेक्ट्स हो जाएंगे विदाउट एनी वरी.
देखें, रिसर्च को ऐसे कंसीडर नहीं करेंगे, इट इज़ एन एडिशनल सब्जेक्ट. इट इज़ द पार्ट ऑफ योर करिकुलम नाउ ओवरऑल पाकिस्तान. सो लाइक एनाटमी के लेक्चर आपके होते हैं, पढ़ते आप खुद हैं. आपने कभी एनाटमी के लिए शिकायत नहीं की कि भाई इसके लिए हमें टाइम नहीं मिलना पड़ना है, बिकॉज इट इज़ अ पार्ट ऑफ योर करिकुलम. From head to toe anatomy you cover in first 2 years along with your other subjects like physiology and biochemistry. So research is not a choice. Research is a part of your curriculum now. करना तो पड़ेगा because it's a subject. So consider it as a subject, not as an additional burden in your curriculum. So इसको as a burden नहीं लें, ये आपका subject है और ये आपने करना ही है. The good thing is that you have 5 years. For anatomy you have 2 years. For some subjects like forensic you have 1 year. लेकिन for research you have 5 years. So it is a part of your curriculum. It is not an additional burden to you guys.
I think this is was very nice question. ये ऐसा क्वेश्चन था जिसने जो भी स्टूडेंट्स यहाँ आए सब स्टूडेंट के दिल को छू लिया है, ठीक है ना, कि हम पे इतना बर्डन क्यों. प्रीवियस में 50% पास था, आज 65% पासिंग कर लिए. प्रीवियस 60% अटेंडेंस थी, हमारे पे 90 से फिर उन्होंने राम खा के 85 कर दी. तो बेटा एक्चुअली बीइंग अ नेशन, सो वी ऑलवेज रेजिस्ट द चेंज. अगर हमें यहाँ कहा जाए ना कि अगर आप एक चेयर से उठ के 7 वाली चेयर पे बैठ जाएं तब भी हम कहेंगे नहीं यार छोड़ो मैं इधर ही ठीक हूँ. तो चेंज को हम रेजिस्ट करते हैं, बट दिस शुड नॉट बी, बिकॉज whenever there is change, this is in your favor. If you will look at the globally, what they are doing and what we are doing, how many of us they are doing research, study at the foreign countries, and what we are doing here. सुबह 8 बजे आया, 2 बजे क्लासेस पूरी हो गई, फिर घर चला गया. पढ़ने वाले ने पढ़ लिए, बाकी सारे स्टूडेंट घूमते रहे. तो we have lot of time. इट डजेंट मीन कि अगर 75-65 हमने पासिंग कर दिए तो बड़ा बर्डन बढ़ गया, अब हम रिसर्च कहाँ से करेंगे, क्या करेंगे. नो, नॉट एट ऑल. व्हेन आई वाज डूइंग PhD आउटसाइड, so there the students were habitual to come at the night even. They are involved in के रात को आ जाते हैं, सर teach us, taught us various experiment, tell us what is this, getting information from the senior faculty. Even our professors, they were habitual to sit there up to the 12 night. So round the clock, they were busy in research, in study, teaching, all the activities. But look at ourselves, what we are doing. See the ground realities. हम क्या कर रहे हैं, कितना हम पढ़ रहे हैं, कितना हम टाइम अपनी स्टडी को दे रहे हैं, being a student. So I would suggest, forget all these things. Time is much more for you. You should have intention that you want to do something, and you have to compete with the international students. When we pass out the final year, our students they think we have to go for the play, you have to go to our USMLE, we have to go to this one, we have to go to here and there. Then we think. But most of our students are not ready for that, and then they waste the many years for their preparation. But you should prepare from now. Okay, this is your destination. You have to reach there. This Pakistan is our country. This is not our destination. हम यहाँ ग्रेजुएट होंगे, कमा भी लेंगे, घर भी चला लेंगे, जॉब भी मिल जाएगी. But this is not should be the aim. Aim वो होना चाहिए बेटा कि जब आए हैं तो कुछ करके जाएं, ऐसा करके जाएं जो आपके बाद भी याद रखा जाए. Thank you very much.
Thank you, our distinguished panelists, faculty members, and students for your thoughtful contributions. Today's discussion on breaking barriers, overcoming challenges for undergraduate students and researchers has shown us that while obstacles are there, they can be transformed into opportunities through mentorship, institutional support, and student initiatives. As we conclude, let us remember that empowering undergraduate research is not just about projects or publication. It is about nurturing curiosity, innovation, and leadership for the future healthcare. Together, we can break barriers and open new doors for the next generation of researchers. This brings us to the end of the panel discussion. Let's move to the shield distribution. I would like to invite Professor Dr. Ashok Narsani, Dean Medical and Dean Surgery and Allied, Professor Dr. Munawwar Alam, Dean Basic Sciences, Professor Dr. Khalda Sheikh, Secretary of the Conference, Dr. Ranomal Priani, Member Organizing Committee, and Dr. Nazia Mumtaz, Co-Chair of the conference, to give shields to our panelists. I would like to invite Dr. Farooq first. Please receive your shield from Dr. Ashok Narsani. Now I would like to call Professor Asad Ali Khan to receive his shield from Professor Munawwar Alam Ansari. Now I would like to call Professor Dr. Shahid Hussain Sumro to receive his shield from Professor Khalda Sheikh. Now I would like to call Professor Dr. Salma Ratni to receive her shield from Dr. Nazia Mumtaz. Now I would like to call Dr. Fauzia Ali to receive her shield from Dr. Ranomal Priani. Last but not the least, the shield of moderator for myself, it will be delivered by Dr. Munawwar and Dr. Ashok. Now I would like to call Dr. Fauzia to receive her shield. Dr. Saima, please come at the stage. Now I would like to call Professor Binafsha Manzoor Sayyed to receive her shield from Professor Khalda Sheikh. Thank you very much. Now we will move to
Thank you so much, panelists, for such an insightful session. Now we will be taking a short break. Students, you are advised to remain seated, while faculty members, you may now please proceed to DME for high tea. Ladies and gentlemen, Professor Asad Khan would like to speak a few words.
Assalamu alaikum. I'm Professor Asad. This is my first visit to Liaquat University of Medical and Health Sciences, and I see a galaxy of stars that you have. What a great workshop, what a great conference you have organized. I don't know most of the people here, But I would like to especially thank Professor Atir. He has done a commendable job for getting people from nearly all of the Pakistan. I'm from Fazaiya Rutfa Medical College, and I'm seeing the bubbling students with energy. So you are most welcome to join us at Khan University in future research conferences. And one of the faculty that you have is Professor Banafsha. She is such a gem.
Thank you so much, sir, for your kind words. Faculty members, please proceed to DME for high tea. Dear students, you may now proceed to lobby for your high tea. And we expect you to come back after 30 minutes, please. We request all the participants to kindly join us after 30 minutes, as we will be resuming the session then.